Hello, I am Michelle Gillihan, MSN student, Aspen University. This video will briefly discuss 5 major learning theories and how these theories can be utilized to increase or decrease behavior. This video will also touch on combining learning theories to change behavior and enhance learning. Lastly, this video will discuss 3 separate scenarios, answering required questions in each scenario. The behaviorist concept is to change behavior, change the environment. This theory views learning as a product of stimulus conditions and responses. The operant condition model, positive reinforcement and reward conditioning, can be used to encourage medication compliance in patients with various illnesses and diseases. Following a prescribed medication regimen can decrease chronic pain, anxiety, blood glucose spikes, hypertension issues, fluid weight gain, etc., providing the motivation or reward of less pain, feeling better, living a healthier lifestyle, increased activity, and less medical visits and emergencies. Systemic desensitization can reduce fear and anxiety by first teaching the patient relaxation techniques, then introducing fear-producing stimulus at low levels during a relaxed state, allowing the individual to realize the once fear-producing stimulus will bring no harm. The cognitive concept is to change behavior, change cognitions. A Gestalt principle utilizes simplicity. Moving away from complex explanations the patient may not understand, in favor of providing instructions at the individual's level of learning to increase positive behavior. Also important is to address any internal-external factors that may inhibit learning. In addition, with patient comprehension, this same principle can help diminish or extinguish negative behaviors. The concept of social learning is to change behavior, change the role model, perceived reinforcement, and learners' self-regulating mechanisms. Role modeling is a central concept. For example, a more experienced nurse demonstrating desirable attributes, serving as a mentor for a new orientee, provides for an increase in positive behavior or learning. Again, this same principle can be utilized for diminishing negative behavior in a similar example. The nurse that is not acclimating well to the workplace and exhibiting negative behavior may be teamed up with a nurse demonstrating more desirable attributes in hopes to distinguish negative behavior, allowing for assimilation of positive attributes. The concept of psychodynamic learning is to change behavior, change interpretations, making unconscious motivations conscious. This theory is not always looked upon as a learning theory, stressing emotional motivation instead of cognition or responses as in other theories, with the principal theory behavior may be conscious or unconscious. Working with the patient to uncover unconscious motivations, possibly from childhood experiences, and moving these motivations to the conscious can provide for increase in learning and positive behavior. Understanding the reality and necessity of defense mechanisms can open up discussions about emotions and feelings, decreasing the stressors of reality, allowing for openness in thought and decreasing negative behavior. The main concept of the humanist theory is to change behavior. One needs to change feelings, self-concept, and needs. This concept is based on the belief that all individuals are unique and desire growth. Identifying and addressing what is lacking in the hierarchy of needs will allow for increase of positive behavior in higher needs. Providing for physiological and safety needs will allow the patient to look at belonging, esteem, and self-actualization, concepts that will promote positive behavior and learning. This concept can also be utilized to diminish negative behaviors of the patient who is trying to fulfill the lower hierarchy of needs in negative ways. How can learning theories be used in combination to change behavior and enhance learning? Humans are multifaceted beings, usually requiring a combination of learning theories to meet a combination of needs. Actively listening to your patient and assessing needs will provide the information needed to guide the nurse in creating the individual educational plan. A positivity in combining learning theories is if one theory does not work as anticipated, another theory may work even better than anticipated. The nurse orientee that has difficulty understanding the concept of titrating medication in relation to physiological data may have a weakness in cognitive learning. Other important information to collect in this situation is what information the orientee already knows and understands, information that can be used as a building block, and how the orientee learns best. It is also important to ascertain if the orientee is having trouble in any other life situations that may be hindering their educational learning ability. The concept of self-efficacy, believing in one's ability to complete a task or achieve a goal, is opposite of attribution, focusing on the situationally caused behavior. The counseling of a nursing student who is failing a nursing course, utilizing the self-efficacy theory, is to counsel the student to look at their own belief in the ability to complete a task versus the believing the failure is situational, self-induced, or otherwise. A major component of the social cognitive theory is observational learning, a process of learning by observing others, then reproducing those learned behaviors. The clinical preceptor in a healthcare agency can utilize this theory by allowing the preceptee to observe interactions between preceptor and patients, followed by a discussion of interactions and answering questions, then allowing the preceptee to reproduce the learned behavior in following interactions. This short video discussed several objectives, including the discussion of 5 major learning theories and how these theories can be utilized to increase or decrease behavior. This video also touched on combining learning theories to change behavior and enhance learning. Lastly, this video answered required questions in 3 separate scenarios looking at the varied learning theories.